Hello, I'm Dr. Lipi and welcome to my show, Health, Humor, and Harmony. Today's episode is the first of a new series called Dr. Roy on the Road, where I'll be talking to regular folks on the streets about a health topic. Today's show is about addiction. My hope is to humanize people who use drugs. As many of you may remember, I'm a doctor who specializes in addiction medicine. So, I went to Penn Station in Manhattan and asked total strangers a question. What is one question you would ask someone with a drug or alcohol addiction? Then I went to people who use substances and asked them to answer that exact same question. Can't wait to show you how it went. Let's get started. I'm Dr. Roy. I'm an addiction medicine doctor. What's one question you would ask somebody with a drug or alcohol addiction?
Are you getting the help you need?
Are you getting the help you need?
Yes.
Thank you so much. One question you would ask somebody with a drug or alcohol addiction?
I would ask them what they need to feel safer.
So what do they need to feel safer regarding their addiction? Thank you so much. What's one question you would want to ask somebody who has a drug or alcohol addiction? What is your main reason for using? Thank you so much. Then I went to a transitional housing site in Manhattan and spoke to a few people with either active or previous substance use disorders. The third person I spoke with was at Penn Station. I introduced myself as an addiction medicine doctor and asked permission to record their responses. All agreed. I then showed each person one of the previous questions. Here are their answers. So I'm Dr. Roy. Are you getting the help that you need?
No, because I don't look for it.
Because
I don't look for it.
you don't look for it?
No,
Why aren't you looking for help?
I don't know. And I want to stop.
You want to
I
stop?
want to stop smoking.
Yeah,
Cool.
you want to stop smoking, right? So what kind of help would you want? Any help. Any help.
Yeah.
Right. Counseling, medications, whatever works. You
Whatever.
want the help.
Yeah.
You got it. But you're not getting it right now.
No.
Okay, thank you. What kind of services do you need to help you feel safer?
Getting all my medication. Getting all my medication most of the time. Right? I don't have to go to them. They have to, every time they have to check the computer and check it out that my refill is out.
Yes.
And refill it back again.
And then your medication will help you feel safer.
Yeah.
What's your main reason for using?
Trauma, and found my brother overdosed. He died from accidental overdose in 2004. 2 days before that, I let a kid sleep on my couch. I watched him shoot.
Shoot himself?
Yeah, from all the trauma, one thing just led to another. The addiction to,
So a lot of trauma. A lot of trauma.
so it's no excuse.
No. Thank you so much for your honesty. Well, first and foremost, I am deeply grateful to these wonderful New Yorkers who were so generous with their time and who helped me create today's show. By the way, I want to add that as a token of my appreciation, I provided juice, snacks, pen, notepad, and $5 cash to the people who kindly shared their stories related to substance use. To summarize, the three questions were, what's your main reason for using? Are you getting the help that you need? What do you need to feel safer regarding your addiction or your drug use? The responses were fairly consistent with the ones most of my patients with addiction have shared with me over the years. For instance, pain and trauma are common reasons why people develop a substance use disorder, SUD, i.e. a drug or alcohol addiction. In order to feel safer, sometimes people need basic items like medications, things that most of us take for granted. Many of my patients have said they need a safe place to live or they need to escape from their abusive partner. And while some people get help, studies show that of the 23 million Americans with a substance use disorder or addiction, only 10% with addiction get the treatment that they need or deserve. The first person with addiction I spoke to was one of the 90% in the US who isn't getting the help they need or deserve. We as a society, including the medical profession, need to do better. Stigma is a major reason why people with addiction aren't getting treatment and care. Let's treat people who use drugs with respect and compassion. Let's practice the entire spectrum of harm reduction principles, from condoms, naloxone, i.e. Narcan, and clean syringes, to health, legal, education services, and safer consumption or overdose prevention sites. Remember, absolutely anyone, including you and me, can develop an addiction, which is a chronic disease of the brain, just like any one of us can develop leukemia, lupus, and liver disease. So how can you get involved? You can donate to and learn more from excellent organizations that are working to change the way we view people with addiction and get them the help that they need. American Society of Addiction Medicine, Harm Reduction International, the Global Commission on Drug Policy, and On Point NYC. Let's all practice more compassion towards people who use drugs and who develop an addiction. You can be saving a life. Well, that's all for today. Here's your joke of the day. What did the fish say when it swam into a wall? Damn! Be sure to tune into my show this Friday, 3 p.m. Eastern, when I'll give an update on monkeypox. In the meantime, be sure to subscribe to my YouTube channel, write comments below, and follow me on Instagram at Health Humor Harmony Dr. Roy. Be well. I'll see you soon.